Can you see the PowerPoint screen now?
Yep.
All right.
Yep.
Perfect.
Okay,
Just tell me when you need to fast forward through it.
All right. So I researched hub and spoke. Next page. This is a way that we can bring multiple communities or neighborhoods under an umbrella of sharing the costs and all the back office support so that we can provide more services to a wider area. And this also allows multiple smaller villages. We could have 100 of them here in Lee County, but we would have one big umbrella, which is the smoke. Next page. Let me get rid of my, how do I get rid of my microphone or my, okay, so uses of the hub. It speeds up the development of the villages, which we just talked about. They take care of all the administrative needs. They also take care of the taxpayer ID, which is the not-for-profit. It also really helps when the villages start collecting money. They're the ones that will help provide the tax deductions to the donors. They provide all of that service. They also provide the legal. They have paid staff. They are the ones that are in charge of everything to do with the computers, all of the networks, everything computer-wise IT. They will also help with any of the databases that the groups have decided that they want to use as a group. They will be able to maintain that. Accounting, which is very important. Accounting would help pay for any of the paid staff as well as any of the incoming bills or invoices if they should have that. And they also have other support roles for the smaller villages. Okay, next page. So talking about that, uses of the hub. Like I said earlier, it's used in large geographic areas. Lee County could be the hub, and then the spokes could be, Lehigh could have 5 to 6 little spokes. Fort Myers could have 20 spokes, and Cape Coral could have 30. It doesn't matter. It's the main hub is the central command headquarters, and the villages then are able to coordinate their own unique programs. For example, if we find that in some of the spokes that they need assistance in drug addiction or alcohol, they will be able to make their own unique programs. And then if other spokes needed them, they would be able to share that with them. Also, resources. It's a good way for the spokes to share the resources. And that way, if there's any grant writing, any strategic partnership, say a big transportation company comes in, like a busing company like Greyhound or something, it would really save on the spokes getting involved, where the hub would be involved. They would make all the negotiations, and then they would assist the spokes in getting out information on that. Going back to standardization, that's my biggest thing is standardization. Everything would be done the same way in the hub, and then the spokes would then do their own unique things that they wanted to do. And also the hub, they handle the day-to-day operations of the big picture. Next page. So this is a chart that I borrowed, and this tells you the top 10 services that village members would utilize. And of course, the biggest one, which did not surprise me at all, is the social events. Our older adults love social events. They love touching and not feeling, but they love touching and seeing our older adults. They do better seeing than by phone. They also want more educational and lectures. They want classes on their crafts. They want to be able to call for information, 1-800 number or one set number, and there's a concierge there / paid person that could give them all the information that they needed. Transportation. This would really help transport those neighbors that need transportation to doctor's appointments, to go get their groceries, even as simple as going to another neighborhood where their family is. If they're not able to walk, they would be able to provide that service for them. Another thing that I'm really seeing in right now is the home modifications, the bars in the bathroom, the bars in the shower. I'm constantly, I would say probably 2-3 times a week, when we go to our veteran visitation volunteer and we talk to the veterans inpatient at the hospital, that's their number one thing. Who do we call to get our bathrooms updated so that we don't have to use a porta pot? That's like one of their number one things. Technology assistant. There's a lot of people that don't have computers out there, but if they have a regular phone or access to a cell phone, if they need help, they'll be able to call that number and get help. So that's just some of the things. Gardening and yard care has really made a focus in my neighborhood. So we have now assigned a family that has kids to 4 of our older adults in our neighborhood, and they go and check with the older adult every week and take the shrubs out to the street. They take the garbage dumpster out, whatever needs to be done, they take care of that for them. I'm not getting the phone calls on that. I'm getting calls on other things, but the yards are taken care of. All right, next screen. Okay, so this is another reason hub and spoke is so important. You'd have the same leadership. Everybody would be adaptable. The program capacity is just out of this world. The individual spokes could have the programs that they wanted, and they would still be able to follow underneath the hub. And I think that's very important. Next page. Okay, so this is a research study that was done from different business models for different villages. They have the grassroots, they have the hub and spoke, the time bank, and parent sponsored. Parent sponsored scares me, so I don't think we should be doing anything with that. Hub and spoke to me is good, if not better, than even the grassroots, because the grassroots, everyone's going to do it their own way. There will be no consistency. And if one of our neighbors moves from one area to another area, it's best if the umbrella is the same, but when they move to an area, they may have more resources, they may have more crafts. So I'm a hub and spoke person. All right, next screen. Okay, so volunteers. Volunteers are very important to this. They add value to the community. And investing in the volunteers is very important because we have workflows. Volunteers would know what the expectations are. We want to utilize them to their potential and likes. We don't want to have a volunteer say they're going to do something and then not like doing what they're going to do, because they're not going to stick around. It's going to develop trust and relationships with their community and their neighborhoods, as well as if we cultivate them, train them, and recognize them, the volunteers will be there forever. Also, they can volunteer in any aspect within the hub. As far as the spoke process, they can help with transportation, cutting grass, grocery shopping, assistance while at appointments. Next screen. One of my volunteers, the same lady with the shrubs out to the road, she now cannot drive. Her car is in her garage. And so now different neighbors are taking her to her appointments. We have an assigned neighbor that takes her to the grocery store, and the two of them go. She will not give up going to the grocery store. Even though she's holding on to the grocery cart and the other neighbor is holding on and guiding it, she will not give that up. So asset mapping. I know we've talked about asset mapping and GIS. They're close to being the same. Will it help? Yes. And the reason is it's going to build stronger partnerships and collaborations with foundations, the aging providers, government agencies, and other stakeholders, so that we can have these communities within the hub and spoke. Now, the other part of that is it's also going to help our clients who are our neighbors. Where are the senior centers? Who are the not-for-profits who provide the service? And also the businesses that cater to the home clients. Those are like the home health agencies. Those are the people that deliver food for the different meals, like Meals and Wheels. And also this provider, the preferred provider referrals will complement the services delivered by the volunteer. So what that means is if you have providers in the community that say it's like United Healthcare, they will assist along with the volunteer. So that way the client does not fall in the crack. So that is something very important because we're seeing more and more with the Medicare, HMOs, and all of the different Medicare subgroups. They're starting to provide, and that will also help with the volunteers. Next screen. Okay, so why? Why is it that we need to do this? Well, one thing is boomers, that they're starting to age in place. And because they're aging in place, they want to stay. A lot of them have lived in the neighborhood 40 years or more. We've been there 35. We don't want to lose our neighborhood, and we want to stay in the community because we know it, we feel safe, and we love it. So one of the things that that really astounded me is aging in place is very cost effective. And I'm like, well, how can that be? If a lot of times the housing where they're living at is paid for, or it's minimal in how much they have for a mortgage. The median monthly cost for nursing home care for 2009 was $5,243. That's 5 times the amount for seniors living at home. Where are we going to put them? There is not enough land to put all of our older adults into housing, into assisted living, into apartments. We're going to run out of space. We need to be able to keep them at home. Also, doing this, having the community and the relationships, isolation will be diminished. Right now with COVID, isolation was the number-one thing. That was the hardest thing for our older adults because they need that connection and they really miss the touchy-feely. If you can visually see them, they do a lot better. I know a lot of some of my neighbors that have their parents in nursing homes, they were looking in their windows if they were on the first floor during this pandemic so that their parents could see them. You know, aging in place also has been found to improve the seniors' overall health, their life satisfaction, and their self-esteem because they're able to stay at home. All right, next one. Okay, so we're going to go back and talk about the businesses again. They are realizing they have to jump in and do what they can because they are finding out that the ones that are younger than the boomers, they're helping the boomers. And because of that, they're providing care for their family members. And it's taking a toll on their own employees. And AARP and National Alliance for Caregiving they stated that 21% of all households are providing for an older adult family member. And I have been in that sandwich generation, and I do not like to be squeezed. It was very hard, very, very hard. Also, MetLife study of working caregivers and employer health care costs reported workers caring for an older relative are more likely to report health problems like depression, diabetes, hypertension, and heart disease, and it's costing the employers $13.4 billion annually. So it is very, it's very important for the businesses to step in and see what they can do to help. All right, next page. All right, so anyone have any questions? Did I hit all the points in a nutshell? Are we hub and spoke?
I think that's really good. I liked how you pulled all that together, and I do think that if we should send it out to all the members.
Okay, well, Abby has, I don't know who all the members are, but Abby could send that out if you just want to make it a PDF. Or if you want me to send you a PDF, I don't care, whatever you want.